So this is a uterine fibroid embolization. They're accessing the right common femoral artery. They're doing an early check at their puncture site, and now advancing along a catheter that they'll use to form a Waltman loop into the abdominal aorta. So they're pushing it up, forming that Waltman loop, and then they'll be bringing that down, using it to select the contralateral common iliac artery here in a second. So bringing it down, engaging the left common iliac, obliquing to better show the origin of the internal. They've selected the internal now. Go back to AP, puffing to identify the left uterine artery. Still searching for the left uterine artery. Now you see it, and the 5 French catheter is advanced to DSA image to map out this uterine artery. And the next step is advancing a microcatheter deep into this vessel prior to embolization. So now there's a microcatheter being advanced deep into the left uterine artery. You see the micro wire and the catheter looping back and forth. The wire is removed, contrast injection as a puff, and then this DSA run to map it out prior to embolization. They've collimated quite tightly and are starting to embolize with little puffs of contrast, and between those puffs you can assess how quickly the contrast is flowing back away from the catheter, also looking for reflux of contrast alongside the catheter, and as well as tissue staining to assess the endpoint in embolization. Getting a little bit further into the embolization, starting to see some reflux along the catheter. There's fairly dense tissue staining downstream. When getting closer to the end of the embolization, often we'll do another DSA run to check the extent of embolization. So at this point there's near stasis in the left uterine artery. DMAG, little puff of contrast. Pretty clear that there's very little forward flow left in this uterine artery. So basically getting close to the end of embolization. This is the DSA run where you see really no filling of those branches and reflux along the catheter up into the internal iliac. Now the base catheter is being pushed back up into the aorta, selecting the ipsilateral or right common iliac artery. Again, obliquing to find the origin of the internal iliac. Now in the internal iliac, switching back to anterior-posterior view, puffing with contrast while searching for the right uterine artery. You can see a little flash of it there. And there, see nice filling of the right uterine artery. The next step will be a DSA sequence, mapping out this vessel prior to embolization. And just like on the left side, next step is taking a microcatheter deep into this vessel, in preparation for embolization. So you see a microcatheter and wire deep into the right uterine artery. Having removed the guide wire, again a mapping DSA showing the branches of this vessel, and next is the embolization. Again, puffs of contrast with the embolic material, nicely collimating in quite tightly. And the embolization proceeds. Again, looking for the same findings for complete embolization. Very little forward flow and typically some reflux along the catheter itself, proving that there's really little, if any, remaining forward flow within the uterine artery. Fairly dense tissue staining at this point. And DSA confirming the lack of forward flow, and basically the procedure's over. The microcatheter has been removed, and the last step is on forming this Waldman loop in this long catheter.